with the airtime stretching system. So now what you're going to do is you have the system anchored on a wall behind you. Yet you can control the amount of resistance right here. I put the bands in for what I want, and now we're just doing leg extensions. So going through there, we're doing leg extensions. So if you know anybody that is, so we're doing leg extensions, and we're going from here. I got the amount of resistance I want. I can pull the rope if I want the resistance to be more. You can get a towel, put the towel under your leg to get a different angle, to get more resistance in that direction. So you can try different angles to challenge your knee. What the physical therapist wants you doing, and the doctor, is basically taking your foot and rubbing it on the ground. So if you have knee surgery or you have a knee pain, these are some ways that they're going to have you doing physical therapy or prehab if you're having any pain. So if you do this, or if you have aging parents that are having trouble with mobility, these leg extensions by sitting in a chair, doing it 2 different ways, which is going to be rubbing the foot or having the leg in the air, is going to go ahead and prehab their muscles and their joints so that they can have the mobility. Most of the time, if you're taking your family members to physical therapy, it's got to be done every day, and that's what this eliminates, is having to go to physical therapy every day. You can do it, basically, it needs to be done 2 or 3 times a week in order to have good range of motion as we're getting older. All right, so airtime.net, buy yours today. Okay. So here's another variation of, we're going to be doing leg extensions. I've just anchored onto this post. Remember, anything inside or outside of your house, to anchor the system, okay? So we're working on just a little bit of range of motion in the hip, but we're doing leg extensions here. So I'm just going to go ahead and raise it up, and we're just going to do it like this. And so I have the amount of resistance that I need based on the bands, and I have the amount of resistance I need right here, okay? Let's say if you wanted to do hands-free, I could just simply tie an overhand knot, and then I can go hands-free so that I can on the exercise that we're doing right now. So to the wall, get connected to your ankle like this. I have a yellow band in there, but if I need more resistance, I can just throw the red or black one in there, and then I can control it with the rope as well. So here's another variation of how you can do leg extensions for physical therapy. All right, so let's say you got back from knee surgery. It's going to be really difficult to lift your leg up. So the airtime stretching system with a mechanical advantage can raise it up. So if you're in bed, you can basically direct your leg over, because you're going to need help moving your leg around. But whether it's surgery or you just have pain in your knee or localized pain, then you can basically do some of these just leg extensions like this. So if you're in bed or if you're outside, that you can do this, and you're having some weakness in your quads, you can do that. The other thing you can do is just grab some of these bands that come with it, and I'll put it on top of my ankle there, and then we can just put our other foot inside, like so, and like that, and now I can have a little bit more resistance there. So I got more resistance, and I'm using the band, but actually you can use another one of these. Okay, so you can put the resistance, okay, you can put a yellow band in so that you can do leg extensions and hold it, contractions. So you're trying to do isometric on the quad. So if it's too much, get rid of the rubber band or add rubber bands, and then just work on doing leg extensions like this. That's it. Okay, another way of doing leg extensions here is we're going to put it on our ankle. You can lay face down. Remember, you can just have this anchored above anywhere in your house. All right, and then you can control the resistance, as you can see on my hand right here. And then you're just bringing your foot straight to the ground there. I got 2 yellow bands in there right now, but if this is not hard enough, I'm just going to go ahead and pull the rope, bring it up a little bit higher, and I'm just going to contract down into the ground, point the toe, have it straight, keep switching that back and forth. I can take my leg to the outside so that you're going to get different parts of your quad as you're doing this, and you're working on your knee rehab. So bring it back in, come from there. And a lot of times I can just go to the outside, bringing it straight down, so I'm working my hip as well. So I go one here, go to the outside. So this is another way to do leg extensions using the airtime stretching system. Go to your gym You can go ahead. So I'm just doing range of motion about bringing my knee to chest, and then when I'm ready to actually start to pull 90 degree, I'm just going to go at like, I don't know, a little bit away from my body, but I got 50 pounds over here now, and I can go ahead and start doing enough that I go ahead and bring it in to bring my knee in tighter, and now make it a little bit harder. And all I'm doing is I'm holding all 3 ropes, and I push into it, and I get my reps of 50 in there. Go hands free, straight out here, go there with that, hands free. And now, while you're at the gym, you can sit there and safely protect your back. You can go ahead and just take the knot out and go back to just stretching, doing range of motion, stretching your hip. And when you're ready, pull your knee back again, hold all 3, change the weight if you need to, and go from there. If the weight's too heavy,